Top 25 Care Worker Interview Questions and Answers. Working as a care worker is not just about providing physical support, it's about compassion, empathy, and dedication to improving others' quality of life. Whether assisting the elderly, supporting individuals with disabilities, or working in residential care, interviewers look for warmth, responsibility, and professionalism. Preparing well for care worker interviews can make a huge difference. The following guide covers 25 common questions and carefully structured answers to help you understand what employers are seeking and how to present yourself confidently. Let's explore how you can shine and demonstrate your genuine passion for caring for others. 1. Tell me about yourself. I am a dedicated and compassionate person with a strong passion for helping others live more independently and comfortably. My background in care work has taught me the importance of empathy, patience, and respect for individuals' dignity. I enjoy making meaningful connections with clients while providing support that enhances their well-being. My communication skills help me build trust with both clients and families. I always aim to promote a positive and safe environment. Outside of work, I continue to learn about health and social care practices to improve my abilities and deliver better quality support. 2. Why do you want to work as a care worker? I want to work as a care worker because I find deep satisfaction in helping people who need support to live fulfilling lives. I believe everyone deserves to be treated with dignity, compassion, and respect regardless of their challenges. Care work allows me to make a real difference each day by assisting others with empathy and patience. I enjoy the opportunity to build trusting relationships and support independence. This profession aligns with my values of kindness, service, and community contribution, and I see it as both a rewarding and meaningful career path. 3. What qualities make a good care worker? A good care worker should possess empathy, patience, and excellent communication skills. It's essential to listen carefully to clients and understand their needs while maintaining dignity and respect. Reliability and professionalism are also crucial because clients depend on consistent and trustworthy care. Flexibility helps in adapting to different individuals and circumstances. A positive attitude encourages confidence and comfort among those receiving care. Above all, compassion and commitment ensure that each client feels valued, supported, and safe. Combining these qualities allows a care worker to deliver not just assistance, but genuine human care. 4. How do you handle a difficult client? When dealing with a difficult client, I stay calm, patient, and professional. I try to understand the root cause of their frustration or behavior, as it may be related to pain, confusion, or emotional distress. I communicate respectfully, listen to their concerns, and reassure them that their feelings are valid. If needed, I adapt my approach to make them more comfortable. Maintaining empathy and consistency helps build trust over time. When necessary, I also report challenges to my supervisor and seek guidance to ensure the client's well-being and safety remain the top priority. 5. How do you maintain confidentiality in your work? Maintaining confidentiality is essential in care work because clients trust us with sensitive personal information. I never discuss a client's details with anyone not authorized to know. I ensure all records are securely stored and only accessed for professional purposes. I follow organizational policies and data protection laws strictly. Even casual conversations about clients outside work are avoided completely. If someone requests information, I direct them to the proper authority. Respecting privacy not only maintains trust but also ensures compliance with ethical and legal standards, which are vital in providing professional, respectful care. 6. What would you do in an emergency situation? In an emergency, I remain calm and follow established procedures. My first step is to ensure the client's immediate safety while calling for help if necessary. I quickly assess the situation, provide first aid within my training limits, and contact emergency services. I then inform my supervisor or the appropriate authority about the incident. Clear communication is crucial, so I document everything accurately afterward. Keeping a level head allows me to make effective decisions and ensure the best outcome. Preparedness and quick thinking are essential to managing emergencies in a professional, composed manner. 7. How do you handle stressful situations? I manage stress by staying organized, prioritizing tasks, and maintaining a positive mindset. In care work, emotional and physical demands can be high, so I practice patience and take short breaks when possible to stay focused. Communication with colleagues also helps share challenges and find solutions. I remind myself that my role is to help, not to be perfect. Outside work, I engage in activities that help me relax and recharge. Managing stress effectively ensures that I can continue to provide compassionate and consistent care, even under pressure, without compromising professionalism. 8. How would you support a client's independence? Supporting independence means encouraging clients to do as much as they can for themselves while offering help where needed. I guide them patiently, allowing time for tasks and praising their efforts. For example, if a client can dress themselves with some assistance, I'll offer support without taking over completely. Promoting independence helps build self-esteem and confidence. I also respect their choices and preferences to maintain control over their lives. This balance between support and encouragement helps clients feel valued and empowered, which is an essential aspect of quality person-centered care. 9. Describe a time you worked as part of a team. In my previous role, I worked in a residential care setting where teamwork was vital for effective client care. One example was when a client required increased mobility support. I collaborated with colleagues to adjust the care plan and coordinate daily assistance. We communicated regularly to ensure consistency and safety. By sharing responsibilities and insights, we improved the client's comfort and progress. This experience taught me that teamwork enhances efficiency, reduces stress, and improves overall outcomes for clients. Supporting one another ensures that everyone, especially those in care, receives the best possible support. 10. How do you deal with confidential information? Confidentiality is central to trust in care. I handle all client information responsibly by following organizational policies and legal guidelines. I only share details with authorized professionals involved in the client's care. Paperwork is stored securely, and digital records are password protected. I avoid discussing personal details outside work or in public areas. If unsure about sharing certain information, I consult my supervisor before taking action. Maintaining confidentiality not only protects the client's dignity but also upholds professional ethics and ensures compliance with privacy laws such as the Data Protection Act. 11. How would you handle a client refusing care? If a client refuses care, I remain respectful and patient. I try to understand their reasons by listening carefully and showing empathy. Sometimes refusal comes from fear, confusion, or a need for control. I explain the importance of the care and offer reassurance without forcing them. If they continue to refuse, I document the situation and inform my supervisor. It's vital to respect the client's autonomy while ensuring their safety. Building trust often helps them feel more comfortable accepting assistance later, as understanding and patience encourage cooperation and confidence. 12. What does dignity in care mean to you? Dignity in care means treating every individual with respect, regardless of their physical or mental condition. It involves understanding that each person deserves privacy, independence, and kindness. For example, I always ensure clients are covered during personal care and that I explain what I am doing before assisting. It's about allowing choices, listening to preferences, and avoiding actions that could make someone feel embarrassed or undervalued. Dignity transforms care from simple assistance into meaningful support. Upholding dignity helps maintain self-worth and builds trusting, positive relationships between care workers and clients. 13. How do you communicate effectively with clients? Effective communication begins with active listening and empathy. I speak clearly, use simple language when needed, and ensure my tone is calm and respectful. For clients with hearing or speech difficulties, I use gestures, visual aids, or written communication. Patience is key. Giving time for responses builds confidence. I also pay attention to nonverbal cues, as body language often conveys emotions. Understanding cultural differences and personal preferences ensures communication feels comfortable. Good communication strengthens relationships, prevents misunderstandings, and ensures that clients' needs are met accurately and respectfully in every interaction. 14. What would you do if you suspect abuse? If I suspect abuse, I take it extremely seriously and follow safeguarding procedures immediately. I record my observations carefully, including facts and dates, without making assumptions. I report concerns to my line manager or safeguarding officer right away. Confidentiality is crucial, but protection of the client comes first. I never confront the suspected abuser myself or promise secrecy to the victim. My role is to ensure the client's safety and that proper authorities handle the situation. Following correct reporting procedures helps protect vulnerable individuals and maintain a safe care environment. 15. How do you prioritize tasks during a busy shift? During busy shifts, I prioritize tasks by assessing urgency and client needs. I begin with essential duties like medication, meals, or personal hygiene, then move to less urgent responsibilities. I stay flexible and adjust plans if emergencies arise. Good communication with teammates ensures nothing is missed. Keeping a written list helps maintain organization throughout the day. I also stay calm and focused, knowing that rushing can lead to mistakes. Prioritization allows me to deliver safe, efficient, and compassionate care while maintaining professionalism, even during high-pressure situations common in care work. 16. What motivates you in this job? What motivates me most is seeing the positive difference my work makes in someone's life. Helping clients feel comfortable, valued, and more independent brings me a sense of fulfillment that few other jobs provide. Knowing that my care contributes to someone's happiness and dignity inspires me to give my best each day. I also enjoy learning new skills, understanding diverse needs, and working with a supportive team. Care work constantly reminds me how meaningful compassion and kindness can be, and that motivation keeps me dedicated and committed to this role. 17. How do you ensure a safe environment for clients? I ensure a safe environment by following health and safety procedures and maintaining awareness of potential hazards. I regularly check equipment, ensure walkways are clear, and encourage clients to use aids properly. Hygiene and infection control are priorities, including hand washing and correct use of protective equipment. I report any maintenance or safety concerns immediately. Emotional safety is equally important, so I create an environment where clients feel respected and secure. Consistent attention to detail and adherence to policies ensure that clients remain protected from harm and live in comfort. 18. How do you handle feedback or criticism? I view feedback and criticism as opportunities to improve. When receiving feedback, I listen carefully without becoming defensive and ask questions to understand how I can do better. I reflect on the advice and take action to strengthen my skills or correct mistakes. Positive or negative, all feedback helps me grow professionally. In care work, learning from experience and others' perspectives improves service quality. Accepting feedback gracefully also builds stronger teamwork and trust with supervisors. Continuous improvement ensures I provide better, more compassionate care to every individual I support. 19. How do you manage time effectively? I manage my time by planning tasks, setting priorities, and staying organized throughout the day. I prepare in advance, knowing each client's schedule and specific needs. By following care plans carefully, I ensure essential duties are completed efficiently. I stay flexible in case emergencies arise, but always return to planned routines. Communication with colleagues helps avoid duplication and ensures smooth coordination. Time management allows me to balance attention between clients and documentation without feeling rushed. Being punctual, organized, and adaptable ensures all clients receive consistent, quality care every day. 20. What would you do if a client fell? If a client fell, I would remain calm and assess the situation without moving them immediately. I would check for injuries, ensure they are safe, and call for medical help or first aid if required. I would reassure the client to keep them calm and then report the incident to my supervisor. I would record all details accurately, including how the fall happened and any observed injuries. Preventing further harm is crucial, so I would also review environmental risks afterward. Following procedure ensures the client's safety and prevents similar accidents in the future. 21. How do you promote equality and diversity in care? Promoting equality and diversity means respecting every individual's background, culture, and beliefs. I ensure all clients receive the same quality of care without bias or discrimination. I take time to learn about cultural preferences, dietary needs, or religious practices to provide personalized support. Communication and respect are key to making clients feel valued and understood. I also challenge discrimination if I witness it. Embracing diversity creates a positive, inclusive environment where everyone feels accepted. Providing equal care strengthens trust and reflects professional integrity in a multicultural care setting. 22. How do you build trust with clients? Trust develops through consistency, honesty, and respect. I always keep promises, arrive on time, and perform duties reliably. Listening carefully and respecting privacy helps clients feel comfortable and valued. I communicate clearly and kindly, never making assumptions about their feelings or abilities. Being patient and empathetic encourages openness and confidence. Small gestures, like remembering preferences or showing genuine concern, strengthen relationships. Over time, these actions create trust, which is essential for effective care. When clients trust me, they feel more secure, leading to a more positive and supportive care experience. 23. How would you handle a client with dementia? When supporting a client with dementia, I use patience, empathy, and clear communication. I speak slowly, maintain eye contact, and use simple language to reduce confusion. Familiar routines help them feel secure, and I avoid correcting them harshly if they're mistaken. I focus on reassurance, comfort, and maintaining their dignity. If they become distressed, I redirect their attention calmly to something pleasant. Understanding dementia requires emotional sensitivity and consistency. By combining compassion with structure, I can help the client feel respected, supported, and safe, despite memory challenges or behavioral changes. 24. What are your strengths as a care worker? My greatest strengths are empathy, patience, and strong communication skills. I connect easily with clients and make them feel heard and respected. My reliability ensures that clients and families trust my care. I adapt quickly to different situations, maintaining calmness under pressure. I'm also detail-oriented, ensuring all tasks are completed correctly and safely. Teamwork is another strength, as I value cooperation and support among colleagues. Together, these qualities enable me to provide high-quality, person-centered care that prioritizes both physical and emotional well-being for every individual I assist. 25. Where do you see yourself in 5 years? In 5 years, I see myself continuing to grow within the care sector, possibly in a senior or supervisory role. I want to expand my knowledge through further training, particularly in dementia care or mental health support. My goal is to contribute more deeply to improving care quality and mentoring new workers. I'm passionate about long-term development and building a fulfilling career that continues to make a positive difference in people's lives. Continuous learning, dedication, and compassion will guide my journey within the health and social care profession. Conclusion. A successful care worker interview is not about memorizing answers but showing genuine compassion, professionalism, and understanding of clients' needs. Employers look for empathy, reliability, and communication skills above all. By preparing thoughtfully and reflecting on real experiences, you can demonstrate that you are both capable and caring. Remember to stay calm, confident, and true to your values throughout the interview. Each question is an opportunity to show your commitment to making a difference. With preparation and passion, you can build a meaningful career devoted to supporting others and enhancing lives.